I'm Marty Sytsema. I'm one of the instructors for Clinical Approach to Myofascial Release. One of the best things I ever learned through all my training is that just because something hurts, don't treat that. There's an old osteopathic saying that pain is a liar. So just by chasing what hurts, you really can get into trouble and miss what you really should be focusing on. And it's really difficult for patients to understand this concept because let's talk about the TMJ. If they're having pain here on the right side, often it's because that side is working too hard. And what we really need to do is to get this mandible moving better. So if this mandible is not moving, you're getting more motion on this side. You're getting more irritation. You're getting that disc moving too much, and you're getting a click over here. And we have to do some things to calm that down. But we need to get what is hypomobile is what we should be focusing on. So often when I'm doing that, the patient says, you realize it's my other side that hurts, right? I'm like, yeah, I know. So one of the things I like to do is to give them some examples, give them some stories, because human history is an oral tradition, and when you tell someone a story, they're going to listen a little bit more. So if we're talking just about something like this, I say, okay, well, think of it this way. If you've got two kids and they have a task they have to do, they have to empty the dishwasher. And what usually happens is you have one kid, typically the firstborn, who does everything that they're really supposed to do, but then the young one doesn't do their job as much. So the task is getting done, the dishwasher is getting empty, but the work isn't equal between the two kids. So what are you going to do? Are you going to yell at and focus on the one that is already doing the job or the one that isn't doing the job? So you have to work on the sibling that isn't doing the job so that the one that is doing more work can calm down and they can rest. And once you kind of balance that out, you don't have as much irritation and frankly, anger. So that works when you're talking about just two joints, but you often get that with the lumbar spine as well, where we have 5 joints we're talking about. And what often hurts is the one that's moving too much, which is surrounded by some hypomobile segments. So if we get those hypomobile segments moving better, then the one that is hyper doesn't have to work so hard. So I'm going to date myself a little bit from this analogy, but I always think about, when I'm describing this to patients, the Lakers from the 80s. Okay, Los Angeles Lakers, Showtime. You had Magic Johnson, Kareem Abdul-Jabbar, Jamal Worthy, and then a couple other guys. James Worthy. Sorry, James. You had 5 guys right there, and they were just up and down all the time. But Kareem Abdul-Jabbar was getting old. So he wasn't getting back and playing defense as much as he used to. So if his guy's down there, that means the other 4 have to work that much harder guarding his people. So to take care of that, we can just tell those 4, well, work harder, go faster, take care of that extra person. Or, come on, Kareem, get back there, get it back on defense. We don't need you just doing all those sky hooks. You need to get back and play defense too. A little other reference to that is, it excuses him a little bit, but the old movie Airplane, him talking about having to drag Russell and all these guys up and down the court. Anyway, watch Airplane. Oh, maybe not. At least that part of Airplane, watch it, because Kareem makes an excuse for himself. If that's a little too old for you, we can also think about the current Lakers, because you've got LeBron there, and he's getting pretty old too. And you can see he doesn't quite come back on defense like he should. So to have a good Lakers team, you need everybody playing defense. Another example I'll sometimes use, and it just depends on what kind of mood I'm in, is for the lumbar spine, we talk about the Jackson 5. So you've got the 5 Jackson brothers, you've got Michael, you've got Tito, you've got Marlon, and then whoever the other 2 are. And realistically, the talent wasn't even between all 5 of those. And you had one of those that was carrying kind of everything. So eventually, the one that's working a little too hard might go a little bit cuckoo and start hanging out with chimpanzees and doing some weird stuff. Anyway, what you need to do is to get the other 4 Jackson brothers to start doing their job, start getting better, so poor Michael doesn't have to go crazy. That's a really weird example. But anyway, I hope you get the idea. So I hope that's helpful for you. I hope that it helps you communicate better with your patients, because when they understand things, they do what they're supposed to do, and therapy goes easier. Thanks.